A healthy and lively child is a universal dream shared by all parents. However, life often throws unexpected challenges and uncertainties to many parents. A cleft lip or palate is one of those unforeseen uncertainties that can arise during pregnancy. Bearing a child with a cleft condition demands extraordinary strength and resilience. What exactly unfolds when you give birth to a baby with a cleft? Where do you turn? And how do you navigate this unfamiliar territory? Join us on this journey through a life of hope and healing. This is the Good Samaritan Nutrition Center in Luwano Village, Namayumba Sub-County in Wakiso District. It is about 50 kilometers northwest of Kampala. The echo of giggles and cries are heard from a distance. The center, not so common in communities such as this, is run by Damalie Namuwanga.
Ekyandetera okubeera bwe kityo natunuliranga abantu abo nga gye bali babasekerera ng'era bwe bayogera oli alwawo nnyo n'awuliriza naye ng'atawuliriza kuseka kati nange ne ŋŋamba bambi abaana bano nange kanfeeyo nnyo okulaba nti mbalaga omukwano okuba nti nabo bafiitingira mu society babeera basobola okuba nti bali wamu n'abantu aba bulijjo ng'era tebeekweka mmanju.
For close to 10 years, Damalie has consistently grown into a household name in the world of babies with abnormalities. We accompany her on her journey to a village about 10 kilometers away.
Eno gye tugenda Lugombe, omwana yazaaliddwa ng'ayina emimwa nga myatifu.
In this homestead, a couple has just had a baby girl with a cleft lip, a split in the upper lip and roof of her mouth.
Nkyanzijira mu bwongo musawo natya. Era nentya nnyo n'empuliranga n'ebyenda bingiise n'enfuna ekitengo. Neŋŋamba omwana wange first born omwana gwasoose okuzaala n'abeera bw'ati buli watula ku mwana we ng'akaaba.
Mother and her bundle of joy are being taken to a nutritional center where they will be managed alongside other children like hers.
Buli omu gwe tuleeta n'asanga munne n'amusanga ng'ayina ekizibu kye kimu aguma.
Christine Nampela and her baby, Ivan, for example, were brought here to save them from social rejection and discrimination.
Nali saagala okulaga omwana oyo abantu kuba natya nnyo nga ŋŋamba ebigambo bigenda kuba bingi ate ne ku kyalo kw'embeera nze yasooka okuzaalako omwana oyo kubanga we namuzaala terina ogu abantu bajjanga okulaba omwana naye ŋŋamba komyawa bweru nise nga ŋŋamba daddi we tuulaawo ajja okulaba omwana bawe emboozi basituke bagende.
Children with birth defects like clefts or palates are a center of scorn and stigma, especially in rural communities. Their birth is attributed to bad omens and witchcraft. Mothers bear the brunt of this stigma. The Nutrition Center is therefore a safe haven for them. Here, they're welcomed with open arms and live freely. Most of them are from low-resource rural communities and underprivileged families.
Abantu bentera okuyamba embeera zaabwe family tusanga nga teyina ssente nga baavu ddala nga tebalina wakujja azadde omwana tasobola mumulabirira oluusi abaana balemererwa ne bafa.
A cleft lip is an uncommon occurrence for many individuals in Uganda. However, a recent survey done in 5 healthy facilities by Smile Care Uganda, a non-profit corrective surgery organization, showed that about 1,100 babies were born with the condition in 2022. It further indicates that the causes range from genetic factors to nutritional influences, as Dr. Rose Arenyo, a cleft surgeon at Chirudu Hospital, explains.
You find that if the grandmother had cleft lip, or the cousin or somebody has a cleft, there is increased risk of that family developing cleft lip. Nutrition, it's been studied, observational studies, where very many mothers are observed, and it's found that if they have deficiency, especially of micronutrients, there are higher numbers of children that are born with birth defects. And then the other factor is drugs. So anybody that is on drugs, you always think of risk of having children with birth defects.
Much as palate clefts are treatable by surgery, the availability of such services in most rural communities and cost make it hard for most families to get care. It would cost close to $1,000 or about 3.5 million Ugandan shillings to get this care in Uganda. The Ministry of Health blames this cost on budgetary constraints.
Budget, I must say from the start that it's small, very small. Here at the Ministry of Health, the budget is less than 1%. The prioritization of oral health, even at hospitals, is very small. It still comes to the budget. This budget that buys medicine for the general hospital is where the oral health department taps into to have its own medicine.
On top of this, children born with the condition need specialized nutrition because some are unable to breastfeed.
Those that have the cleft that is involving the palate is essential for grabbing the nipple, so these babies tend to have challenges grabbing the nipple.
Era nalina kugabirira mugabirire paka nakati. Namugabiriranga amata paka watuuse okunywa obuugi.
The roof of the mouth separates breathing and feeding. So if they have a cleft that is involving the roof of the mouth or cleft palate, then air, breathing and food are going at the same time. So they tend to have a risk to take in food in the wrong direction.
Era byatusumbuwanga nnyo okumunywesa okwo kuba oluusi wamunywesanga nga biyiika.
The center aids mothers in filling nutrition gaps for their babies. Inside the center, we observe babies receiving specialized nutrition plans tailored to their needs, known as children.
Tusooka n'apimibwa ne tulaba kiro z'ayina. Abamu tubaleeta ng'ayina kiro emu n'obutundutundu 5. Omulala n'omusanga ng'ayina 2. Nzija emmere yaffe n'ey'obutonde bw'ensi, emmere eya bulijjo. N'entabula emmere yonna okugeza tuyina bwe tuba tufumba emmere yaffe ey'ekitobero. Tutabula emmere yonna. Omwana buli lunaku alina okufuna emmere yonna okugeza emmere ey'ensolo, emmere ezimba omubiri, emmere etambuza omusaayi n'emmere enyiriza olususu.
Together and collectively, they grow vegetables, fruits, and various local foodstuffs to sustain the center. First off, how are women and children mobilized to come here? Through outreach programs, the center has built an information network that interacts with communal leadership models to identify families with cleft and palate cases.
Abantu bano mbafuna era ku radio, ku simu, enkesi yonna.
After proper nutrition is achieved and children have attained a healthy weight, the center links up with the medical charity Smile Train Uganda, an umbrella of doctors and plastic surgeons who carry out surgeries at no cost. Ivan was brought here weighing 6 kilograms. He is now 9. He is a candidate for the next surgery at the facility located about 200 kilometers west of Kampala in Chotera district. Many other children will be part of the exercise.
Ekinkomezaawo omwana wange ayina ekituli munda. Basooka kuvunizaako kungulu kati balina obbuniza munda. Nze nali mulaba nga sikitwala nti oba munda wabeerayo n'ekituli oba biri bitya nga simanyi. Ne wano waaliwo abaana era we batyo nga ayina kungulu ne munda. Kati nange we namanyira nti kati n'owange akirina ekyomunda kati ennyama eri yali tennazimba kwawula kituli.
Upon arrival, mothers are briefed about conduct, hygiene, and care for the baby ahead of surgery day tomorrow. The surgeries will be overseen by plastic surgeon Dr. Sister Najuka Justina Gerardine, along with a team from Smile Train International, a US-based plastic surgery charity.
So we as Surgical Center Smile Train decided to bring the services nearer to the people, other than the people coming nearer to us. So we go out monthly, every 2 weeks in a month, a group of us travel to a center where such patients are mobilized. Some of them haven't started school. They are 10 years and the moment they appeared in school, so they coil, they are rejected. So we want to take away that.
Before surgery, all babies are cross-examined by the medical team for any complications. Those who don't pass the check are rejected, much to the disappointment of mothers.
Embeera teba nnyangu maama omutegeeza ddala kituufu nti omwana we tagenda kukolwako olunaku olwaleero kiba kizibu nnyo kitwalira okumubuulirira ennyo okumugumya omutima kubanga ye alaba abalala bakoleddwako ye takoleddwako. Kati omwana ono alina okubeera ng'afunye ekkiro ezimala era nga munene mulungi. Tujja kubanga tukama ebbeere eriryo nga tuwa omwana agejje alabike bulungi era kampu eziriba ziddako omwana ajja kukolwako teweeraliikirira. Abamu bagaana okubeerawo n'adduka n'addayo ewaka. Omwana bw'aba alina kiro 2 ye n'alowooza asobola omuliisiza ewaka agenda okudda nga era akaana katini ate ng'ayagala mumuleete akolebweko.
However, this is part of the procedure here.
For a lip to be operated, you start at 3 months. For the palate, it is 9 months. So if you're 9 months, we go ahead and you have all the other basics. You are healthy, there's nothing wrong with your heart and so on. There's nothing as stressful and saddening like taking baby or somebody to theater and they don't come out to mommy. So that is why we do our screening very, very thoroughly, so that if it is truly a medical accident, then it is an accident.
This model has existed for about 20 years and restored the lives of over 16,000 children from underserved communities. Away from the children, monthly outreaches also serve adults with the same conditions. Around 20 children underwent surgery at St. Andrew's Health Center, Bikira this time. The surgery caravan has served communities in the districts of Arua, Gulu, Jinja, Kampala, Masaka, Wakiso and Hoima, and has replaced the gaps in both district hospitals and regional referrals. Some of the people who were served like Rule Palera returned to give back.
neyongera okuba nga mbegattako nemperezaako ku bakyala bano buli kimu nemba nga mbayambako buli mulimu gwonna gwasiza wamu amatanga ago buugi nembafumbira.
However, congenital abnormality cases are on the rise in Uganda, Dr. Najuka affirms. And yet, no efforts are seen at the Ministry of Health to prioritize them.
There isn't really a desk for congenital issues. You know, if there was a desk and a vote for congenital, ailments like cleft lip, cleft palate, those things happen. But we are managing them by chance.
The treatment cycle does not end at surgery. A follow-up is needed to monitor the healing and nutrition of the children. Damalie takes the mantle again. We tag along on her way to Christine's home in Nachifuma Mukono district to monitor post-surgery progress of baby Ivan.
Mpisawo omwezi nendaba omwana mu mwezi guno ali atya oba nesimu ekola nnyo wayitawo ennaku 3 ng'avudde ku ddwaliro n'enkuba oba wiiki muli mutya bwe kitwala omwezi oba myezi 2 ate awo n'entambula n'entuuka ku mwana ndabe omwana oyo gwe baŋŋamba ddala kati yatandika okulya ate byalya tebiyita mu nnyindo tewasigalayo katuli keetaagisa kulongoosa.
Unlike our first meeting, Christine's face now is lit up with joy and relief as she gazes at her baby. He had previously suffered from a cleft, but is now fine. Tears of happiness stream down the mom's face as we reflect on Ivan's laborious journey to restoration.
kuba kati nange nzasobola obbeera mu bannange ate ekitaaliwo lwe nali kati nga buli kaseera najja n'atunula n'oyagala obikke tebamulaba naye kati tewakyali buzibu.
Ivan will now be taken through speech therapy exercises to strengthen the muscles and mouth cavity, as well as techniques to improve his pronunciation of words. And for the volunteer plastic surgeons, it's the smiles of babies like Ivan's that keep them going.
Cleft lip, cleft palate surgery, I think it's the most rewarding surgery in the whole world because you see the results immediately. The moment you hand mommy the baby, that's already enough.
Abantu nga ozadde omwana totya okutya kubaawo naye totya guma obuyambi gye buli